The United States is currently navigating a significant demographic shift, with the baby boomer generation reaching retirement age and beyond. This has brought the issue of senior care to the forefront of national conversation, highlighting a complex and evolving landscape of options, challenges, and opportunities. As life expectancy increases, the demand for effective, compassionate, and affordable care for older adults is growing at an unprecedented rate. The primary models for this care fall into two main categories: home care, which allows seniors to age in place, and assisted living facilities, which provide a community-based environment with varying levels of support. Both options represent critical components of the American healthcare infrastructure, each with its own set of benefits, drawbacks, and financial implications. Understanding this system is essential not only for families currently making these difficult decisions, but also for policymakers, healthcare providers, and society as a whole, as we grapple with the responsibility of caring for our aging population. The choices made today will shape the quality of life for millions of Americans in the years to come, defining our collective commitment to dignity and well-being in later life. Home care has emerged as a widely preferred option for many seniors and their families across America. The fundamental appeal of home care lies in its ability to allow older adults to remain in the comfort and familiarity of their own homes, a concept often referred to as aging in place. This model is predicated on the belief that maintaining independence and connection to one's personal environment can significantly enhance quality of life, mental health, and overall well-being. Home care services are highly customizable and can range from non-medical assistance with daily activities to skilled medical care provided by licensed professionals. For instance, a senior might receive help with personal care tasks, such as bathing, dressing, and grooming, as well as instrumental activities of daily living like meal preparation, light housekeeping, medication reminders, and transportation to appointments. This level of support can be tailored to the individual's specific needs. Whether they require assistance for just a few hours a week or round-the-clock supervision, this flexibility is a major advantage, as it allows the care plan to adapt as the senior's health status changes over time. Beyond the practical assistance, home care aides often provide crucial companionship, helping to combat the loneliness and social isolation that can be prevalent among the elderly. For families, this option offers peace of mind, knowing their loved one is safe and supported in a cherished environment. The one-on-one nature of home care ensures personalized attention that is often difficult to replicate in a larger facility setting. However, the home care model is not without its significant challenges, particularly concerning cost, caregiver quality, and the burden placed on family members. The expense of professional home care can be substantial, often running into thousands of dollars per month, and it is frequently paid for out, while some long-term care insurance policies may cover these services. Medicare's coverage is typically limited to short-term, skilled nursing care following a hospitalization, not the long-term custodial care that most seniors need. This financial strain can be a major barrier for many American families. Another critical issue is the quality and reliability of caregivers. The home care industry faces high turnover rates and a shortage of qualified workers, driven by low wages and demanding working conditions. Finding a trustworthy, compassionate, and skilled caregiver can be a daunting task for families, involving rigorous background checks and interviews. Furthermore, the responsibility for managing and overseeing care often falls on family members, who may already be juggling their own careers, children, and personal lives. This can lead to significant stress, burnout, and financial strain for these sandwich generation caregivers. The emotional toll of coordinating schedules, managing finances, and making difficult health decisions can be immense, while aging in place is the ideal for many. Its practical implementation requires a robust support system and financial resources that are not always readily available, making it a difficult path for a significant portion of the population. On the other side of the senior care spectrum are assisted living facilities, which offer a residential solution for older adults who need some assistance with daily living but do not require the intensive medical care of a nursing home. These communities are designed to foster a balance between independence and support. Providing a structured yet home-like environment. Residents typically live in private or semi-private apartments and have access to a wide array of communal amenities and services. A key benefit of assisted living is the built-in social infrastructure. These facilities offer planned social activities, group dining, and shared common areas, which actively combat the social isolation that can be detrimental to a senior's health. This sense of community can be a powerful antidote to loneliness and can help residents form new friendships and maintain an active social life. From a practical standpoint, assisted living simplifies many of the logistics of daily life. Services typically include 3 meals a day served in a communal dining hall, housekeeping, laundry services, and transportation. Most importantly, staff are available 24/7 to assist with personal care needs and respond to emergencies, providing a crucial safety net for residents and peace of mind for their families. Many facilities also offer wellness programs, fitness classes, and on-site access to basic health monitoring. This comprehensive bundled approach to care and living can be an attractive option for seniors who are no longer able to manage the upkeep of a private home and for families concerned about the safety and well-being of their loved ones living alone. Despite these advantages, the transition to an assisted living facility comes with its own set of complexities and drawbacks. The most significant barrier for many is the cost. Assisted living is a private pay industry, with average monthly costs often exceeding $5,000, and this figure can vary dramatically based on location and the level of care required. As with home care, Medicare does not cover the cost of room and board in assisted living, and while some states offer Medicaid waivers to help low-income seniors, these programs often have long waiting lists and may not be available in all facilities. This financial reality places assisted living out of reach for a large segment of the American senior population. Beyond the cost, the loss of independence and personal autonomy can be a difficult emotional adjustment for new residents. Moving from a lifelong home into a smaller, regulated environment can feel like a significant loss of freedom. While these communities strive to be home-like, they are, by nature, institutional settings with schedules and rules that residents must follow. The quality of care can also be a concern. Staffing ratios, training levels, and staff turnover can vary widely between facilities. Families must conduct thorough research, including visiting multiple communities, speaking with current residents and their families, and reviewing state inspection reports to ensure they are choosing a high-quality, reputable provider. The level of medical care is also a consideration. Assisted living is not equipped to handle complex or acute medical conditions, and a resident whose health declines significantly may need to transition to a more skilled nursing facility, leading to another disruptive move. The future of senior care in the United States is poised at a critical juncture, shaped by demographic trends, technological innovation, and evolving policy discussions. The sheer number of aging Americans will continue to drive demand for both home care and assisted living, forcing a reevaluation of how these services are funded and delivered. One of the most promising areas of development is technology. Innovations such as telehealth, remote patient monitoring, smart home sensors, and medication management apps have the potential to make aging in place safer, more efficient, and more affordable. These tools can help seniors maintain their independence while providing families and healthcare providers with real-time data and peace of mind. In the assisted living sector, technology is being integrated to improve operational efficiency, enhance resident engagement, and provide more personalized care. At the policy level, there is a growing conversation about expanding public funding options for long-term care. Discussions around creating a public long-term care insurance program, expanding Medicaid waivers, and providing tax credits for family caregivers are gaining traction. The goal is to create a more sustainable and equitable system that does not force families to deplete their life savings to pay for necessary care. Furthermore, there is a push towards more integrated models of care that blur the lines between home and facility, such as continuing care retirement communities, CCRCs, that offer a full spectrum of living options on a single campus, from independent living to skilled nursing. This allows residents to transition seamlessly as their needs change. Ultimately, addressing the senior care challenge will require a multifaceted approach involving private innovation, public investment, and a societal shift in how we value and support our elders. In conclusion, The landscape of senior care in America, encompassing both home-based services and assisted living communities, is a direct reflection of the nation's ongoing effort to meet the needs of its aging population. While home care offers the invaluable benefit of allowing individuals to age in a familiar and cherished environment, it presents substantial challenges related to cost, caregiver availability, and the immense pressure placed on family support systems. Conversely, assisted living facilities provide a structured, community-oriented solution that ensures safety and social engagement. But this often comes at a high financial cost and requires a significant personal adjustment to a loss of autonomy. Neither model presents a perfect solution, and the choice between them is deeply personal, contingent on an individual's health, financial resources, and family dynamics. As the country moves forward, the dialogue surrounding senior care is increasingly focused on creating a more integrated, affordable, and person-centered system. The integration of technology, the exploration of new funding models, and a greater emphasis on supporting family caregivers are all critical components of this evolution. The path ahead requires a concerted effort from policymakers, healthcare innovators, and communities to build a framework that honors the dignity of every older American and ensures that their later years are lived with security, comfort, and respect.